This meeting is being recorded.
So welcome everyone. I'm Susan Fountain, and Jean Grassman and I are happy to welcome you all here tonight for our web presentation on advocating for health and safety using the PESH process. So we have two very experienced presenters here with us tonight. One is Patricia Geisel. She is a registered nurse and she oversees NYSUT's Health and Safety Committee. She has firsthand experience in many aspects of health and safety issues, both in the educational and the clinical setting. She's been involved with NYSUT for more than 14 years, serving her local and Rockland County. She's a grievance committee member and then picked up responsibilities of the union's negotiating team. She's worked closely with the Tarrytown Regional Office and her labor relations specialist in tackling the many problems presented in her district. So, so happy to benefit from her experience, as well as that of Ellen Lynch, who's the founder of the Footwear and Accessories Design Department at the Fashion Institute of Design and Technology here in New York City. So a longtime member of the United College of Employees of FIT. She joined the officers first as a membership director and then as vice president for environmental health and safety. So in that role, she was instrumental in developing a member-driven health and safety committee. She's currently the executive vice president of the United College Employees of FIT. And as executive vice president, she also serves on the college-wide environmental health and safety committee. So we have two great union people with specialty in health and safety issues to speak with us tonight. So I'm gonna turn the floor over to you.
Great, thank you, Susan. I'm Ellen Lynch, and as soon as we get the deck up and running, I can begin. This was a presentation that Patricia and I did last week for the community college conference through NYSUT, and it was very, very well received. So I am the storyteller of our duo here, and I'm basically going to walk you through some of the things that FIT went through in order to get where we are right now. We had a lot of bumps in the road. We had major setbacks. And right now we have some construction going on with a new building being built 12 inches away from an existing building. So it's a little precarious, but I'll walk you through it. So next slide, please. Okay, so the concept here for our presentation is basically understanding the differences between OSHA and PESH, what your worker rights are, engaging with labor and management, health and safety committees, health and safety issues, engaging your members, and also really developing a solid health and safety community for all. Next slide, please. Okay, next slide. Okay, so now I'm going to tell you our success story, which for the most part is a success story, but it's also a work in progress. One of the things that we learned along the way is that in order to have a voice at the table, you really need to have your own health and safety committee, and it needs to be established through your union. I don't know, Susan, do you guys have your own health and safety committee?
So yes, we have very active health and safety committees on some campuses.
Good.
And
Good.
yeah, representatives on most.
Okay. We did not. We had one or two people that were officers of the UCE. We had one or two people that were part of our executive committee who were really concerned about the safety within our laboratories and within our overall community. And we pushed NYSUT in order to find out how we could establish a committee, and they were very, very supportive, but we didn't really do it until after we had a major crisis. And the major crisis that we had were in two laboratories. One was mine in the footwear laboratory, and the other one was in the science lab. We realized that because of the ventilation that was in each one of the rooms, particulates from those rooms were being blown out onto the streets of Manhattan. And somebody complained who was in the neighborhood. They called PESH. PESH came down and closed our facilities and told us that we could not use them until we changed the chemicals that we were working with. For us, that was an eye-opener, and we realized that if we were going to have any kind of say in how our community worked, we needed to set up our own health and safety committee. Next slide, please. Okay, so this is FIT. As you know, or I hope you know, FIT looks out on 7th Avenue. We are between 28th Street and 26th Street. We have dorms on the street, but we also have community businesses on that street. So we couldn't close the street. We needed to work within the community itself. We set up a health and safety committee. We ended up coming up with a mission statement for our committee. We worked to establish floor monitors in each one of the buildings so that in the event of a fire drill or an active shooter drill or a smoke issue, those individuals would ensure that everybody on those floors got out safely and got out in the proper manner. We had one incident where a glue station caught fire and everybody was evacuated from the building that you're looking at right now. And health and public safety, instead of moving everybody to a good location, ended up leaving us across the street. So had the building really gone up in flames, we would be part of that explosion. So we also learned about that. What you see here is starting a college-wide committee. We fought to have a college-wide committee. Our school was not interested in anything related to health and safety other than having a director of environmental health and safety on the campus, which was required by CUNY. Our committee went to the president and said, we believe that we have a cancer cluster at the college, because every single area within the college had one or more people who were diagnosed with cancer. And we ended up doing a study, and the end result of the study, after we sent it to Memorial Sloan Kettering, was it wasn't what we were doing now, it was what we had done 20 years ago. And of course, when you know FIT is all art related, all of the solvents, all of the materials that we used all had carcinogenics. But that forced us and forced the administration to realize that we needed to have, I'm using your phrase, a watchdog facility. that could monitor all of the major issues within the college. And so a college-wide health and safety committee was established. These were the members of the committee. We had the CEO, somebody from HR, the president's office, the office of general counsel, the nurse, and a union rep. In order for a college-wide committee to be responsible and to make decisions, you have to have people on that committee who can make the decisions. And in the beginning, we did not have anybody that could make the decisions. So again, we floundered. We came up with ideas. We came up with things that could help the college, but nobody was in a position to say, okay, let's do it. Next slide, please. Okay, so even though we didn't have anybody of importance, we were able to have fire doors installed in the hallways. We didn't have that before. We had fire doors installed in classrooms and offices. We had call boxes set up on campus so that in the event that somebody was outside and needed a public safety or an emergency ambulance, we now have call boxes. We developed a policy for X-Acto knives. I can't tell you how many people get cut on a regular basis because of improper X-Acto use knife and disposal. We set up a checklist and an evaluation or assessment for each one of our classrooms, our studios, and our laboratories. We developed an active shooter protocol, which again, we never had, and we also had training. And we developed a policy regarding service animals on campus. But we also bargained in order to make sure that our adjuncts and our part-time staff were paid for any training that they needed to take in the areas of health and safety. Next slide. Okay. These are some of the other things that we were able to pull together once we developed a college-wide committee. Scissor lift training, emergency procedures for everything from weather to medical emergencies. And I've given Susan a copy of a one-page document that hangs in all of the classrooms and facilities so that people can address the issues. We streamlined the accident reporting system. It used to take public safety anywhere between 20 minutes and a half hour to get to an incident and write up a report. Now it's done immediately. They get to the facilities within 5 minutes time. And we still have our own union committee, which meets monthly, and we go over a variety of issues, which are then brought to the larger college-wide committee. Next slide, please. And then COVID hit. And when COVID hit, everything came to a standstill. But the one thing that didn't was the fact that all of a sudden the college realized that this health and safety committee that we helped establish was the one vehicle that was going to be able to get any kind of information to the community. And so our little committee of a half a dozen people suddenly became a committee of 40. And we worked to pull together a document on coming back onto campus, what they needed to do, how they needed to report any issues, and it had been constantly updated, monitoring those cases of COVID, monitoring vaccinations, And yes, we are probably the only school in New York City that still has a mask mandate. Next slide. Okay. What we were able to do in our union contract is to establish a temperature situation. So if the temperature inside a classroom reaches 85 degrees, or if it reaches below 65 degrees, it is the responsibility of the college to relocate that classroom. And if they can't relocate it, everybody is released and they go home. Right now, because of the construction that's going on with this new building, on the 5th, 6th, 7th, and 8th floor of the existing building, we have windows that are completely open. We have tarps that are hanging from the top of the window down to the floor in order to catch the rainwater that's coming in. We went to the administration and said, this is unacceptable. We cannot have classes running this way. They poo-pooed us and said, that's ridiculous. You can do it. We had a torrential downpour last week, and a whole bank of sewing machines were damaged because the water got into the oil filters and we couldn't use any of the machines. The temperature in those rooms was above 85 degrees because of the heat coming off of the sewing machines, the heat coming off of the fans in the room, and the heat coming off of the irons. Those classes remained offline for a full week until they tried to figure out what to do and to lower the temperature. In one of the rooms, the room that I use, water came in through the radiator and flooded the floor, which doesn't really sound that bad, except we have outlets in the floor. So they went and they covered the outlets with duct tape, thinking that that was going to be what was going to help us. Our classroom, my classroom, is offline until they figure out how they're going to fix it. That is the ability of this committee, to get things done, to get things in the forefront, to get the administration and the president to realize that we have a problem. And yesterday, for the first time, the president's designee came down to look at these rooms. They have been under construction since the summer. And she finally came down to look at the rooms and realized what it is that we've been talking about. Next slide, please. Okay. We did deal with monkeypox. Thank goodness there wasn't an issue there. And we continue to look at some of the major issues that are existing with this construction. As of today, we've asked that another committee be formed to look at bringing the caliber of the old building up to or pretty close to the level of the new building, so that when people walk from one building to another, they don't walk from a depressed area into an incredibly luxurious area. And we believe that we've made headway with that. But I will tell you the bad part, and it is all my fault. After we got finished with COVID at the last EHS meeting of 40 people, I asked that the committee rethink the number of people on the committee, and that we look to subdivide the committee into areas of concern that we needed to deal with. It went over, I thought, very well, and everybody was very supportive. And that was in May. And we have yet to have another meeting of the college-wide Environmental Health and Safety Committee. So I blame myself. We did get a note about an hour ago saying that we are going to have a meeting on Friday. So let's see what happens. But the takeaway from everything that I've told you right now is if you establish a college-wide EHS committee, you must have people on that committee that can make decisions, because otherwise you will just be spinning your wheels. And that's one thing that you can't afford to do. Thank you. Next slide. And that's it.
Okay. So the important takeaway from this is that it's the responsibility of the union members to participate, that you want to make sure that your voices are heard and that your issues and concerns are addressed, and that the administration can address those concerns. So I think at this point, it's a good time to ask if there are any questions. If anybody has any questions that they'd like to ask, especially of Ellen and her experience.
Just take the slides down so we can see if there are any questions. Either in chat or raise your Zoom hand.
Mm-hmm.
I have a question. Oh, Kevin, go.
Mm-hmm.
Hi, good evening. My name is Kevin Adams. I'm at Medgar Evers College. We have an emergency management preparedness committee, right? And in some ways it sounds similar to what you're describing, but in some ways it sounded different. So I was wondering if you could just go over again the structure of the committee you have.
Sure, Kevin. Our committee, the college-wide EHS committee, consists of the CEO, the CFO, the head of IT, the nurse. Sometimes the nurse is replaced by our part-time doctor. We have one person representing the union. We have one person representing staff, because our contract is wall to wall. So it's both faculty as well as staff. We have individuals from buildings and grounds, from public safety, from facilities rental, from every aspect of the college. And that's why it's ungainly. It's way too big. If I was going to consolidate it, I would consolidate it to the director of environmental health and safety, the person from buildings and grounds, the union representative, a faculty representative, a staff representative, and then the CEO and CFO. Anybody else, and public safety, anybody else in any of the other areas could be brought in if you've got an issue that needs to be discussed and a policy set up or an issue resolved. They don't necessarily have to be there on a regular basis.
Okay, because I guess the structure you suggested, your preferred structure, is pretty close to what we have at Medgar Evers College. But I guess,
that's great.
Well, this is the part where I guess I'm now trying to think out loud. So forgive me for not getting this off quickly. I've been on the committee we have here at the college here for 10 years, but we really haven't gotten a lot done, right? So some of the people are there, but I guess my concern is that we have this committee. Many of the things you discussed, I raised as issues or things we need to consider, but we gain no traction. So I guess the thing we're missing on our campus committee here is we don't have the chief financial officer, and we don't have someone, I guess, who's akin to the CEO on it.
Exactly, because that's what we had in the beginning. We had a wonderful committee. Everybody worked beautifully together, but there were no decisions made. And so the same issues that we brought up in September, we were still bringing up in May, because nobody could make that decision. You need somebody who's a money person, who knows the budget and who's able to say, yeah, we can do this, and no, we can't do that.
Okay. Thank you.
You're welcome.
Jean, I see your hand up too.
Yeah, I guess what you're describing then is a joint labor management health and safety committee.
That
You
is
have
correct.
members of the administration as well as the union. And it sounds like if you have public safety, you have multiple union representation on it.
We have multiple union representation in that many of the people that serve on the committee are union members. But the only two people that are union officers happen to be myself and Eric Ramirez, who was head of the NYSUT Health and Safety Committee and is now our vice president for grievances. So it's the two of us that are really speaking on behalf of the union.
Okay, so you're the explicit union representatives.
Yeah.
Yeah.
And the other thing too that we've learned is you don't go into these kinds of meetings with pie in the sky ideas. You go in with black and white information that the administration can take back and determine whether or not it's viable.
Okay. Yeah, I mean, we have, I think what Kevin is talking about, we actually have both at CUNY. We have, and I was at Brooklyn College and we actually had something akin to what you're talking about with kind of the same problems. But in addition, the PSC also has, just purely a union health and safety committee on the various campuses. So it's kind of, we've got both present. And Kevin, you might want to contact the PSC committee about certain issues. There's we do walkthroughs and try to be creative in moving things along. So
thank you. Yes, I'm in contact because I'm also the delegate. I'm one of the HEAL delegates at Medgar.
Oh, okay. All right.
So, but I guess what I was trying to figure out is because some of the things that are brought up in the Emergency Management Preparedness Committee as a member of that committee, we gained no traction on, right? So I was trying to, I guess, understand, was this more working as the committee that was explained was more working as an agent of the union or as an agent of the college?
Both.
Okay. Yeah, and I got that from your explanation. So
yeah, so Kevin, give me an idea of one of the things that you're not getting any traction on.
Active shooter training.
They're not in support of it?
Which just hasn't happened.
Okay.
So we've raised, so as a member of the committee, I've raised it multiple times, brought up the fact we've not done one in years, maybe at least 5 or 6 years was the last time they had one on campus. We have a lot of folks who are new here, who were not here during the last one. You have people who were floor captains who no longer work on the college. These are things we need to go back and revisit and clean up.
Okay. Homeland Security, if you call them, they have wonderful pamphlets and videos and information that they can send you on active shooter. If you talk to your local police department, they will come in for free during a common hour and do an active shooter workshop for your people. And if you speak to your public safety, they should be able to walk through your campus into the classrooms and say, okay, in this particular classroom, this is where you need to hide. This is what you need to do. It's all out there. It's free. And have your union be the one that's responsible for bringing that training onto campus.
We can do that. What Ellen is saying, it's easy to get active shooter training. I mean, there are people that are out there that will do it. So it can happen.
Yeah.
and I'll be quiet. But Ellen, I'm so jealous that you have a temperature, a temperature, environmental temperature piece of the contract. That's great. We've struggled with that for years. That's really
If
great.
you want, I'll be more than happy to send you the language.
Yeah, we'll take it. Thank you.
You're welcome. You're welcome.
So Ellen, can I ask, how did you get that in your contract, that language?
That's been in the contract probably for about 25 years.
25 years?
25
Wow.
years. And the reason it was there was because the president of the college at the time and the president of the union at the time sat down in a room and said, we need to do this. And we need to do this for the health and welfare of the community. We were very, very fortunate at the time to have a really caring president.
Okay.
Yeah.
Any other questions before we move on? Not. Patricia, did you want to take it from here?
Okay, if you want to put the slides up, that would be great.
Patricia, I'm just going to close my video so that you have the floor.
Okay, thank you. All right. So next slide, please. Okay, so we're going to be talking about OSHA and PESH because really that is the structure that allows all of us, especially what Ellen and her team was able to achieve at FIT. So it's OSHA and PESH. The Employees Health and Safety Committee has a very important role in this. You need to look at your school policy, the code of conduct, and there is also federal and state regulations. Next slide, please. So the Department of Labor, and then underneath it comes OSHA and PESH. Both of them are underneath the Department of Labor. And next slide, please. So OSHA is for the private sector. So it writes and enforces standards, and then there are state OSHA approved programs, and the requirement is they must be at least as effective. I don't know if anybody's been paying attention, but Arizona is trying to weaken that. And actually, up until last month, OSHA was accepting public comments about allowing Arizona to continue their PESH program. So next slide, please. So the OSHA Act of 1970, the employer is responsible and is to furnish to each employee a place of safe employment that's free from recognized hazards that are causing or likely to cause serious injury or even death. And next slide, please. I also want to mention that not only does the employer have a responsibility, but so do the employees. And I think that Ellen equally addressed that in that both labor and management have an equal seat at the table. You can have all of the rules and regulations. The employer hypothetically could follow them, but if the employees don't, or if the employees are following and the employer is not. So it really is a mutual responsibility. And there are standards for a lot of the industries, but where there is no specific, there's a general clause. And a lot of times, if you look on the OSHA website, if you look at letters of interpretation, they will look to other industries like ASHRI, the American Journal of Medicine, nursing. There are many other standards, NIOSH, that they'll look to, especially for weightlifting. Next slide, please. So am I covered by OSHA? Am I covered by PESH? So here is a map. And from this, and we'll talk about it a little bit more, you can tell where you are. And so in New York, of course, we are underneath. If you work for a public entity, you are underneath PESH. Next slide. So who is not covered by OSHA is state and local government workers. If you work at the state and local government, you work for the fire department, schools, CUNY, you'll be underneath PESH. And New York is one of, as you can see, along with Connecticut, Illinois, Maine, New Jersey, and West Virginia, that we have state plans. Next slide, please. So PESH covers public sector employees, state, county, town, village governments, public authorities, school districts, paid and volunteer fire departments. And next slide. So all state and government workers are covered. And this is where we get our sources of right. And PESH can create stronger standards than OSHA. And we'll talk about that more later. The next slide, please. So the Public Employee Safety and Health Bureau, so the Department of Labor of PESH has 2 programs. One is inspection and one is consultation. So the employer, next slide, please. The next, you can, as an employer, you can contact PESH to do a consultation. And it's free. And so you can, it'll come in and conduct an inspection. And that is, they're not there for citing. They're going to ask, the employer, why do you want us to come in? What is it that you want us to look at? So they have a general idea. There's usually a meeting beforehand. What is it that you want from us? What do you want us to look at? The employer could have, maybe they've done some construction or they've added on, maybe they've noticed some injuries. They want an assessment. And so PESH is really very much so willing to come in and take a look at the environment and conduct inspections. So then they do a notice that they're going to be coming. And if it's unannounced, we'll talk about that. That is different. If somebody complains, which we'll talk about and we'll cover the, if you want to file a complaint, sometimes PESH will show up unannounced. And then, they'll tell the employer who it is that they want to accompany them. So, and PESH sets up its own penalties. Next slide. So who's at the conference? As I said, PESH will identify. Maybe they want a representative for maybe the union. If an employee fills out the form, on the form they can check off whether or not they want to be disclosed. There's an actual box. Yes, you can tell the employer that it was me, I, Patricia Geisel, complained, or no, I don't want it to be known. Usually PESH rarely ever discloses. They don't have to. They have the authority. They have the right to be there. And so they will sit down and they have a conference before, and then afterwards there is a closing conference. And they usually tell if there are any violations or things that they want them to fix. They will tell them at that time. They'll give them a specific time period that they want the abatement to be done. Next slide, please. So these are the penalties that are involved for if they exceed the abatement date. And so as you can see, there are different fees. I don't know if you can read it, but it's, and I have to put on my reading glasses, so excuse me. But it's like $50 a day for non-serious, and it can go up to $200 a day for serious. And so the daily penalty will start with the abatement date given. And then until it is, and PESH determines, it's not the employer pulls up and says, oh, it's fixed. No. PESH is going to come, they're going to make sure. And then that's when the penalty stops. So next slide, please. So OSHA has standards, but so does PESH. And so we're going to be talking a little bit about the differences so that way people understand what they're going to do. So, and it's important sometimes when you fill out the form, If an individual wants to do it, that certainly is your right. But as my past experience is, it's usually best to run this by your union, by your rep, and let them know that you're going to do it. Because sometimes you want to be very specific. If you're writing something in a vague way, you know, PESH will come in and look, but they're not really sure what you're specifically talking about. So if you know the standards, it does help when you fill out the form. The other thing is that all of this is online. So OSHA has a website. It's osha.gov. You can look up standards, you can look up regulations, even if you don't know what it is. You can just do a search, a general search, and the information is there. The other thing to look at is if you can't find the standard, is to look at the letters of interpretation. So for instance, there is really no specific standard for how much nursing assistants or in the hospital have, you know, what's the maximum weight that you can lift for a patient. But when I looked at the letters of interpretation, there it was that they went to NIOSH and they went to the American Journal of Nursing, and they wrote back to this individual, an employer who wrote in questioning, you know, how much weight are health assistants allowed to lift. And so there it was in the letter of interpretation was about, it's actually 31 pounds, but they used NIOSH's formula and they referred to a specific article in the American Journal of Nursing. Next slide, please. So in OSHA, for your report of injuries, it's log 300, but PESH calls it 900. So I just wanted you to see this on the blue, which is very legal. And this is when you look at the PESH website and you're looking up a particular standard, you're going to see this official, and it's going to tell you the codes, the regulations, and then comes. So the codes don't necessarily match. You're looking at chapter 11 and it's going to be code 12 and it may be, you know, something 800, but what you're looking at is the forms. So these are the forms that employers have to use, you know, when you get injured on the job, they have to keep a log. There's an actual individual injury report, and these are the form numbers. This is all online, and I don't know, have many of you, you know, you can just raise your hand. I'm just curious, does the college post every year in the spring the number of injuries? Teresa, you're looking at me like I'm nuts. So anyway, they are supposed to do that so that you have an idea of your colleagues and how many injuries are there. And so all employers are required to do this, OSHA and PESH. Next form, please. So this is the log of injuries. This is at SH 900.1. It's the summary of records from the previous year. And they must be posted from February to March. You can actually request them. They are supposed to show them and it's supposed to be posted. And then there's the injury and illness accident report form, and that's 900.2. That's the individual one. So PESH is requires your college, all public employers, to keep a log of illness and injuries. Like if there's a death, there's a requirement of how many hours they have to report it. If somebody goes to the hospital, even let's say they fainted, it doesn't matter. They went to the hospital, it has to be reported. Okay, next slide. And this is the annual summary report. And this is what you're going to refer to, 800.32, okay? Yep, and so just what people can familiarize. All of these forms are online so that you can become familiar with them. I think it's important to ask for them, even if they're not posted. It's important that the union, the association, whatever you want to call it, ask for it, because it's a way to communicate to the college administration that you know what your rights are. These are your sources of right. And sometimes we don't know how many people are getting injured. And when you see this, And if you begin to follow it through, you can see maybe there's a lot of injuries in maintenance. Maybe they don't do lock out, tag out properly, and maybe they need education and training. So being aware of why people are getting injured at the job, then you can do what we call a root cause analysis to understand. Just because there's water on the floor, like one day I was at work and the nurse, there was an emergency and I was working with another nurse, and she walked, opened up the door because it was a big, heavy steel door. She runs outside and there's water on the floor. She falls, ends up breaking her elbow and has surgery and pins and stuff. It's easy to say, well, there was just water on the floor, but when you do a root cause analysis, it turned out that somebody had washed the floor, they didn't post a sign, it was during school hours, and it was just before the change of class. So a root cause analysis is really important. And when you have this, you can do that. Next slide. So come February, remember to ask for this. Next. So the important thing for PESH and OSHA is really, it's about safety. OSHA has a sign, work doesn't hurt. And supposedly all of us, when we leave our houses or wherever we live and we go to work, we don't expect to get hurt. We don't expect to be injured. There's a expectation unconsciously that we are going to be safe. So safety comes first. And so the goal, and OSHA says the employer has a responsibility to prevent workplace injuries and illnesses. Your health and safety team can improve compliance with laws and regulations, and you can do that with PESH and OSHA. Your contract, looking at school policy, codes of conduct. And the overall goal and the result of doing this is that there's going to be reduced costs, including significant reduction in the workers' compensation premiums. I know for where I worked, the nurses did all the workers' comp forms for the employees. And I can tell you, it has to be hundreds that over my lifetime of 19 years at Rockland County, I think I must have done hundreds of workers' comps. And it's just the cost to the school districts is enormous. And it just really shows me that there's not enough training because people are getting hurt, buildings are old, and people are getting injured. So the other thing by having a health and safety team is that, and as Ellen talked about, you engage workers. You engage and you're able to organize around certain issues that people care about. Right now, it could be construction, it could be heat, whatever it is, people can organize. It also enhances everybody's social responsibility towards goals, and it increases productivity and enhances overall business operations. And education is a business. And when people can go to school and learn, and you can teach in a safe and healthy environment, everyone is in a win-win situation. The background of this, because health and safety is a long time and it's still ongoing, I belong to a larger national COSH organization. And you just see that our roots, health and safety started in the 1700s, and here we are still in the year that we are in, and we are still fighting for health and safety. So this, and I go to the North End, I'm sure a lot of you have been to the North End, but 100 years ago, there was a molasses flood. And one of the vats of molasses, there was a 15-foot wave that went down from the North End to the water, and a lot of people were injured and killed in this vat that exploded of hot molasses. So fighting for our health and safety, working collaboratively with administration, labor and management is an ongoing issue, I think. Next slide, please. So it's important to know what your rights are, and this is the Occupational Safety and Health Act of 1970 to assure safe and healthful working conditions for working men and women by authorizing enforcement of the standards developed under the Act, by assisting and encouraging the states in their efforts to assure safe and healthful working conditions provided by research, information, education, and training in the field of occupation and safety. They just attended a workshop encouraging young individuals, or really anyone, to enter the field of health and safety. And it was really fascinating to see students on the University of Virginia campus, asking about careers and safety and health, and postdocs talking about how they came to this field. So it's an ongoing, I think, experience, health and safety. Next slide. So you want to know your rights, and that knowing them gives you, I think, leverage. I know for me, I worked in East Ramapo. I don't know if many people are familiar with that. We're close to the city. It's a very large district with a lot of old buildings, wires hanging down, buildings under construction, asbestos, mold, sometimes no heat. We still don't have, running water, I mean, enough to flush the toilets and wash your hands, but that's it. Some of the buildings are, there's all of the buildings still have water coolers because you can't drink from that. So, but knowing the rights and knowing about lead testing and all of that helped us to be able to advocate. We had a nurse, and I was telling Ellen this, I had to help her one day, and I found out that she was working in a trailer. And this is really a story about not communicating, because by this time I was an officer, I was a president, and I went to the trailer, and little did I know, for 3 years she was working in a trailer with no heat, no hot water. So it's winter time, snow on the ground, 44 degrees in the trailer, no running water, no bathroom. And she worked there for 3 years. And I did not know that she worked in such conditions. And had I not gone there because my building was closed, I would not have known. So she didn't know her rights. She was petrified to speak up, afraid of losing her job. So didn't understand that, retaliation is not acceptable, not allowed. So it's important to know your rights. And, you have the right to work on a machine that's safe. She had a right to work in a place that was warmer than 44 degrees in the winter time. You also want to be protected for toxic chemicals, especially for your people who work in maintenance and custodians. They have a right to the safety data sheets. You want to make sure that people know what they're working with. And Ellen's story of cancer and people working with chemicals, although it was 20 years ago, we don't know the lasting effect of chemicals. So having those safety data sheets is really important. So the other thing that, I think is important is to also know your contract. And what's in your contract is another way to support knowing your rights. Next slide. Mm-hmm.
Ellen or Patricia,
yes,
there's a question.
Sure.
Jay.
Okay.
Yes, sorry to interrupt. I have to go to another meeting about a union too. So, and I don't know if it'll be totally relevant, but one, I'd like to get a recording of this. There's a lot of great information, so I don't know if that'll be emailed. Secondly, I'm at College of Staten Island, CUNY, and we were told after the pandemic they were going to, refit the classrooms, get them, safe. But we don't have any air filters. And I know a colleague of mine, fellow union activist at BMCC, they've got the HEPA filters. They're called Puro. But we don't have anything. And there's horrible circulation. You can't open the windows. So I was just curious from other folks, was there a fight around this? And how did they get this? I guess at our union meeting, I brought this up. And the chapter chair basically said, the CSI management determined that they weren't necessary, that there was enough circulation, and they dropped it at that. So I was just curious about other folks, how that came about.
Okay, Ellen, you want to
So
answer?
Mount Sinai has an occupational safety and health clinic. And you can call them and you can tell them that you are concerned about the air quality that you are breathing. They will send somebody to your campus. Doesn't have to be announced. They will go to your campus. They will do an evaluation. And if necessary, they will make it mandatory that you get HEPA filters.
Who is this? Who's the contact?
It is Mount Sinai Hospital. It is their occupational safety and health area.
Right, I don't know if anybody can see, I'll make a copy of this, but these are
Okay.
they're throughout the state, as Ellen is talking about. They also have a pediatric component to it, but they specifically deal with occupational health issues. Yeah.
And Jay, also, I'm getting some distortion.
Okay.
A quick answer is you can also, we talked.
Oh, okay. Yeah, my internet connection.
Jay, you froze.
He's gone.
Okay.
So what were you going to say?
Oh, what we've done a lot through the watchdogs is in those sorts of situations
Hello.
to we
Yeah,
press on it
am
on our
I
organizations
back?
to we ask for ventilation information. So we ask for air changes per hour. We ask the type of HEPA filter. We ask for the percentage of outside air, and then when they real tangible numbers. And so that is, if they can come up with that, and it may be that there is adequate ventilation, but it's too easy to just say it's all right, there's no problem.
Okay.
You don't
Oh,
need
Can you hear me now?
Yes.
Oh, okay, good. Who's we? The woman that speak? I'm sorry, I can't even see your name.
I'm
Oh.
Jane Grassman. I'm with the PSC Health and Safety Watchdogs, and so I was talking about the PSC Health and Safety. And usually this is done through chapters too, but essentially press on your administration for the specific information.
Okay, great. This again, there will be a recording of this.
Yes.
And that'll be emailed us.
Yes, and you can also email us. I'll put it in the.
Yeah, could you put that in the checks? I've got to go right now. This is great. I appreciate all your efforts.
There was also a situation at FIT because when we were closed for 2 years, we were very concerned about the HVAC system being run on a regular basis. And our concern was for Legionnaire's disease. And we had somebody from PESH come down, also from Mount Sinai, and do a test, and they found that there was bacteria. And as a result, we made it mandatory that the system be run on a regular basis, regardless of whether or not there were people on campus.
I see another question in the chat from about the Lehman College Office of Health and Safety. The question is, are they employees of the college, or is oversight done by another organization? I believe so.
Most of it is done by another organization. In our case, the Director of Environmental Health and Safety does go around with those outside people to ensure that everything is done properly.
So this looks like perhaps it's the college environmental health and safety office. So Jean, I don't know if you want to respond to this question, but there was an issue with the air quality there and a moldy and musty smell.
This is the question in the chat?
Yes.
I don't see it.
Scroll back up. It's just right before the email address that you posted. Yeah, so I see the link that you just dropped in the chat. Yes, that would be the college's, that's part of the college administration. It looks to me like, so that would not be, that in that case, that would not be an outside body. That would be a college employee. That's the health and safety office of the college, who are sometimes good allies and sometimes people we have to do some negotiation with.
Always. It's a relationship, you
Yeah.
know, a work in progress. It's always an ongoing relationship.
For sure.
So if you want to contact someone in a PSC, contact us at the Watchdogs email address that Jean put in the chat there, hswatchdogs@pscmail.org, and we can follow up with you about that specific issue.
Okay.
All
So
right.
then, okay. So
Susan,
we'll,
if you want, I can put my email also in the chat box if anybody wants to contact me directly.
Thank you.
all right. And if you want to put this, if there are no more questions, I'll just finish up with the slides.
Okay, let me
Oh,
get them
yeah.
back up there again.
Yeah. So I just want to talk about, and Ellen did an excellent job of this, about who's on the committee. And I think that she covered it well, because in the end, you need somebody who is going to be able to make decisions. Otherwise, you're just, to me, caught in the gerbil, you know, the gerbil wheel. You're going round and around, and there's such a feeling of helplessness and hopelessness, and people tend to drop out. And then it's, to me, they feel there's fatigue and, you know, despondency, and nothing ever changes. But one of the things that I think when people begin to see progress is that it gives people a feeling of hope. Also, the employer, to me, has a responsibility that they should lead by example. So if you have an apathetic administration like Jay was talking about that just brushes it off, if people don't pursue that, you know, then nothing gets done. There has to be, I think, one of the things that having a health and safety team does, it provides a mechanism to identify and report hazards and to have concerns. So having a health and safety team, usually once you're established, you establish protocols about how things are going to be reported. Like in Philadelphia, they have an actual app and a website that all of the stakeholders can type in or report any concerns that they have. You know, there's water on the floor, a window is leaking, they take pictures, they send in videos, they verify it, the union verifies it, but then they have an actual picture and documentation. So when they meet with the administration, they have concrete evidence. It took them a while to get up and doing it, but it really has been extremely effective for them. And Ellen is going to be sending out, we'll be sending out tomorrow about, they did a wonderful job at FIT about handling emergencies and a mechanism how to address that. You want to get input from as your stakeholders, you know, people that matter, that have a passion for it. And always with health and safety, I think when you work on things, you have to verify, is the team functioning? Are you meeting its goals? And if you have a work list, you know, checking it off. If you have a honey-do list, you want to make sure that things are getting done. So next slide, please. Oh, I don't know what, oh, that's my notes. Ellen talks about. All right. So, you know, I always feel that, you know, you start at the beginning. Do you have a health and safety policy? What's the mission statement of the college? Are their values, their mission, and do they match, right? So it is safety and health, one of their core values. And it's important for administration and staff to participate. And employers have to lead by examples. And the employee is your most valuable asset. Really, who knows the building inside out? People who go in every single day. They know what's going on in that building. They know the conditions, especially building and maintenance, custodians. They'll tell you what's wrong with the building for sure. You want to have those people for sure on your committee. You want to make sure that workers know about OSHA or PESH and their rights. Give workers the opportunity. The employer has the responsibility to make sure that workers have the opportunity to participate in the program. You're going to give them time to do that. And you want to make sure that they participate. Next slide, please. So I don't know if anybody's done this. Kevin, you made me think of that. And I think this is, to me, one of the greatest tools is to map your workplace. And I know it's a large campus. FIT's huge buildings, some of, you have multiple buildings, but the thing is to conduct an initial workplace inspection. You want to map it out. You literally want, and you can get a hold of the drawing because a lot of campuses and buildings have that. So, and you want to walk around and do room by room and look at the conditions. Sometimes take pictures. To me, you're creating an archive, a document, like a photo album of the place where you work, that when you leave, it'll still be there, your photograph album for the future, members of the Health and Safety Committee. You want to know about your chemical hazards, physical. I'm working with one place upstate where they opened up a building that had been closed for many years. So it's septic tank, which is unusual. They've been cleaning out the septic tank for 3 weeks consecutively. There's a smell of obviously sewer gas. Banisters were hanging off. It was just, anyway, they closed the place, So PESH came in, EPA came in, and they said, oh, no work can go on here. They weren't even doing the asbestos abatement correctly. So you want to know what the biological hazards are. You want to know about, any muscle disorders, exposure assessments, and your medical records. So this is all part of your photo album that you're going to keep when you do the map of the workplace. After you do get all of your information, next slide, please. Next slide. Okay, so you want to collect and review this information. Next slide. And so a hazard, how do you know what a hazard is? It's really anything that you get injured, anything that would, leads to a source of injury, illness, or death. So you have safety hazards, health, like for the PPE during COVID and even monkeypox, that comes underneath health hazards. And you have, workplace violence. You have stress, activities that cause wear and tear, especially for people that are lifting, and assigning an untrained person to do a hazardous job because the employer has a requirement to train that individual. Next slide. And so when you're after you do your assessment, you want to list them in a priority. And so this is how PESH does it. I often think that if you do things like how PESH is going to do it or OSHA, it helps you to identify, excuse me. So they do it by eminent danger. That gets addressed right away. Then accident investigations, complaints, serious hazards, non-serious, referrals, follow-up inspections, program. So there might be something very minor when you do the inspection, and it's not a threat to anybody's safety or health, but you have more prominent ones like no windows, like where Ellen is, water going into electrical outlets, and they put duct tape. I don't think that's too safe. So those things would be absolutely imminent danger, and they get addressed first. So it's about safety first. Next slide. And so this is the hierarchy of controls, and this is how PESH and OSHA look at them. So elimination, so you want to eliminate things immediately. So if they're in the basement, right? And that's where the custodians maybe will be, or maintenance people. You can't get down the aisle. If there's an emergency, how are they going to get out? So you're going to look at, maybe you need to eliminate that. Substitution, engineering controls, administrative controls. What can administration do to improve the safety? And of course, PPE. Next slide. And so after you gather all of this, it's an assessment time. Look at your written materials. Look at the safety data sheets. That's what SDS stands for. Your medical and incident investigation reports. You're going to take the 900 and you're going to look at that, identify areas of concern. You want to, this is not a one-time deal. Like Ellen said, they do it annually. And I think that's a good thing to do. Maybe you want to do it before school opens, or, designate a same time so that every year you go back. You'll see as you begin to keep this record, you can see things got worked on, things got improved, what hasn't been addressed, or new things, because, maintenance is always ongoing. Just think of if you own a house or a condo, there's always the honey-do list, as I say. So before making any changes, that's the other thing, is that management and employee, I think, is also, they should be doing the inspection with you if you can. And if they don't, then you certainly can bring it to their attention and ask them to come and see it. Because as Ellen said, it's the labor management relationship. And I do feel that it is a relationship. You can get more with honey than you can with vinegar, but not to say that you can't move to a position of adversarial, but I always try one more of a cooperative first. And then if I have to, I can certainly have a bite to me or to the team. Next slide. So education and training management is responsible for that. And I'm wondering, and Jay brought up about, about violence and getting that training. But any chemicals that are brought into the college, they're supposed to notify people that they are. And for the people that handle the chemicals, have they received that training, that they know what they're dealing with and what is required? So if you have to ask for the safety data sheets, as one OSHA representative said to me, then that's a barrier. They should be accessible where everybody has access to them and you know where they are located and you can just go and check and see.
Patricia,
So,
one
yes.
of the things that we were able to achieve also is right to know training. For anybody that has a lab or a studio, they are required to go through this training annually.
Right. So do they do it for all? How do they do it, Ellen? New employees or?
It's for new employees and existing employees, because as you just said, there are a lot of chemicals that are new to a laboratory that we need to know about, and we go over them on an annual basis.
Right. And really when you work, especially for the science, and you want to make sure about the hoods, are they working in a lab as well? I'm going to a place.
And also for sewing machines, we never realized that we need sewing machine guards on the needles. And that was something that was brought up and now we have it. So again, it's an additional safety factor for the students and the faculty as well.
Yeah, so I'll tell this cute story. I'm a quilter, but I was not, I came to quilting late in life. And so I took classes from somebody who graduated from FIT. And she was telling me about rotary cutters. Okay, so you have to be very careful. And of course, I went and cut myself and needed a stitch. But she has a wonderful stitch on her, a scar on her index finger. And she said, you have to be really careful of the needle. And I said, it's a sewing needle. And she said, oh yeah, see this scar? And it was before they had guards. And she, on the industrial sewing machine, she has going down the side, like a seam on the side of her index finger from the needle. She said, when you work with a machine that can do 1,000 stitches a minute, you have to be careful. I was like, oh my. So yes, right. And guards are important. And that is a, something that you can, when they talk about mechanical safeguards, that's what a guard is for. Absolutely. Next. Slide. So the other thing that you want to do is evaluate your committee. And that's hard because we all want to think that we're effective, but you really want to be little scientists. My background is nursing. So to me, it's always about assessment, being objective and looking at how well does your committee function? What were its goals? And have they met them? And to look honestly at your committee. What can you do to improve it? And maybe it's fine. Maybe it's just functioning. But to me, it's always ongoing. There's always room for improvement because new things will surface that you haven't dealt with before. Ellen, you have any thoughts? Because you're always evaluating your team.
We do, we evaluate, but for us, it's when you think you're doing a good job, that's when you really need to evaluate, because then you become complacent and you think that everything is going well, and it might not necessarily be the case.
Right. Yeah, I'm in agreement. Just when, you know, you think things are calm, you just wait. The storm is right around the corner. Mm-hmm.
Exactly.
Yeah, okay. So I don't know where we are with our, okay, so next slide. Mm-hmm. And so you want to look at, is there room for improvement? Have you achieved your goal? Track performance indicators. You want to monitor and analyze data. And that's looking at injuries and illnesses, reports. You know, you want to, you know, if you're doing a tracker for illness and cancer, it's also important to do mapping as Ellen had done with hers and keeping track of that. So whatever data you have, you want to analyze it. Does management do a review? You're talking about the college administration. Are they, it's important for them to be a participant in this evaluation. Is the health and safety team involved? Program reviewed, and you want to modify as needed. And I think it's ongoing all the time. When I think of taking care of patients, it's the same thing. You know, the patient comes in, they're in crisis, but they may be in crisis on day 1, but they're not in crisis on day 4. So you're constantly updating the health plan and you're constantly evaluating. And that too, to me, is how the health and safety team works. I look at the building as almost like a living human being, because I'm a nurse, and I always say we take the pulse of the building. And how is the building doing today? You know, how's the patient doing? And how is the team doing? And it's important to do that, to scientifically analyze and assess. Next slide. And so this is just a recap of the things that we talked about. And so I'm wondering if there are any questions, anything that we can answer. So,
So I have a question actually.
Sure. Mm-hmm.
When you're filling out a PESH complaint form, so say one of our campuses wants to submit a complaint form, and you're describing the health and safety issue, how important is it to be able to actually cite a specific standard that's being violated or a specific regulation? Is that helpful? Is it absolutely necessary?
Well, it's not absolutely necessary. And actually, PESH likes to be called. I mean, in the sense of, not that they want, you know, complaints, but they consider themselves to be a resource tool. They love teaching and education. So if you're not sure, you can call them and say, I'm considering, you know, I have this situation at this campus. I'm not sure. I don't know how to fill out the form. You can have a conversation with them. And they'll tell you. So you don't necessarily have to be an authority and know all of the codes. And in fact, I don't know if you can do it, but I'm trying to think. Here is the form, and it says here, hazard description and location. And it says, describe the danger which you believe exists, the specific, and give details, include the physical location. So it's not asking for the standard. So you don't want to say, we have noxious odor in our building. Well, what does that mean? right? So you would want to say there is in room 225 down to room 240, 5 days this week. When we came in, it smelled either, and you can, musty, foul, sewer, or whatever. So you want to have that type of specific information on the form. So I'm going to, and
Do you know what? I think
tomorrow-
I have it here. Do you
Yeah,
want me to
you
just
have it.
pull that
So-
up quickly?
Yep, sure. Okay, so up at the top is page 1, and just yep. So there is notice of alleged, and it's alleged because they're going to come in and check it out. If you keep on, it tells you how. Complete the form as accurately and completely as possible. It's not listing the, requesting the standard. They want a description. So and I'm just doing this for next week with they're complaining of a noxious odor. Sometimes it does helpful to keep an odor, this is just an example, odor diary. So that way, it's Monday through Friday. Monday we come in, it's less, it progresses through the week, right? We've noticed, maybe that they've used new chemicals or they did caulking. In this room, they replaced tile. They replaced floor tile, ceiling tile. They used new carpet. They maybe new caulking. So if you can be as specific as possible. Ellen, would you say that's correct when you've filled them out?
Definitely. And keeping a journal, keeping a diary, a daily diary is the best way to go. We did it for the heat condition in our facilities, and we also did it for some of the chemicals that we use. Yeah.
Right. And in fact, I can send, if you look on the CDC, if you go to toxic chemicals, which I'm sure many of you at the college are familiar with, and you can get to the toxic chemical directory, there is a odor diary that you can track. But the more information you have, when you can give it to PESH in terms of just knowing the dates, when, times of day, you've kept it for a week, maybe you've kept it for however. I'm not talking about something like serious, you're smelling, methane or sewer gas where something is dangerous, but, musty smells or something you want to know. So it says here, required, choose, do not reveal the name to the employer, and then name to the employer may be revealed. I've had both. People say, I don't care, I had enough of them. You can put it in the New York Times. I don't care. I just want this taken care of. And other people are, no, don't tell them. I will tell you what one of the PESH people told me. He said, we don't have to, and we usually don't. We rarely ever. Even when the person tells us, by all means, you can reveal that it's me, they don't do it. They don't have to. So, right. And then you fill out the form. Right.
Thank you.
You're welcome.
Thank you. That really helps. Tim, I see your hand up.
Hi.
Hi.
Thank you. Hey. So I'm in the theater department at Hunter College, and we have a situation in our building. We've been having ongoing situations in our building. The latest, we had a steam pipe that blew up, and now we don't have any heat in the building.
Oh.
One of the senior faculty members has filed a PESH complaint. Should others of us in the department also file a complaint? Is that a good strategy or a bad strategy? And if we do we need to make sure that all of everything aligns? So should I look at to see what she submitted so that mine wouldn't align as well, or is it not necessary to do that once one's been submitted?
I would call PESH. That's
Okay.
what I would do. I would call
Okay.
PESH because there's already a complaint,
Right.
but I would, the more that call and just say we're really, because now it's cold, right? Saturday was 70 degrees. I'm up here in Cohoes, New York. We had snow, thank you very much, on the grass
Right.
this morning,
Right.
29 degrees. You don't have heat. to me,
Right.
that's, you know, an emergent. Ellen, what do you think? Mhm.
Agreed wholeheartedly.
Yeah.
Yeah,
You know, yeah,
yeah. Don't wait for them to contact you. You contact them.
yeah.
Yeah.
And I don't think that you have to align, because sometimes I think that actually is a detriment,
Oh,
because
really?
it looks like, you know, everybody's in cahoots.
Oh, okay. Oh,
And,
that's good
you
to know.
know,
Okay.
so that's what
Right.
I'm saying, you know,
Yeah.
I'm calling because this is me, Tim, you know, no heat, it's freezing down here and I'm being asked to, I'm standing here in hat, gloves,
Right.
and a coat and trying to do props, you know, or whatever you're doing.
Right.
So,
And,
yeah,
and Tim, next time you negotiate a contract, try and get a temperature clause in there.
right, exactly. Mhm.
Yeah, I
So
mean, they brought in space heaters for us, but that's not the solution.
right, and not only
No,
that, I'm wondering, because
There's
I'm thinking,
also, I'm sorry, go ahead.
no, go ahead, Ellen. Mhm.
There's also a very big issue with space heaters too. So you want to be very careful about the type of space heaters that they bring in and where they're located.
Mhm.
Right.
Right. And the other thing, when you said steam pipe, so are we talking about moisture?
Yeah, I know there are multiple issues. I mean, there's also
Right.
mold. We're
Yes.
pretty sure there's also asbestos in the building.
Mhm.
The chair is being told that they can't fix the steam pipe because of the asbestos.
Which is true. It could be because steam pipes are traditionally, yes,
Right.
right. And so, you know, just for clarification, Tim, that asbestos is going to be underneath EPA, a HERA. So if you look underneath on the EPA website,
Okay.
okay, you're going to look, so I don't know if you're on the computer, I can see a little computer light. So you go to EPA
Right. Yes.
website. Yeah, I'm just going to tell you where to go.
Okay.
So you go to EPA and you're going to look up topics and you're going to drop it down and you'll see asbestos. You can go to, right? You're going to look up topics. There's
Yeah.
a drop down window. Going to look up asbestos
Yep. Got it.
and you'll see there's a ton of stuff,
Okay.
ton.
Right.
Okay.
Right.
And that's where
Tim,
you go.
also, if you contact NYSUT,
Mhm.
they will also be able to come and do workshops or do hour-long presentations that will give you all the information that you need to go to your administration with.
Okay.
Right. So NYCOSH is NYCOS, right? NYCOSH.
New York,
In New York,
Occupational Safety and Health.
right? Because it's there's lots of NYCOSHs. I mean, national COSH, there are a lot of COSHs, I should say. So you want to do that and to reach out to them.
Yeah. Got it. Okay. Thank you.
Okay.
Tim, I'm going to share one more thing, which is hopefully of interest to everybody. Just going back to that complaint form at the top, there's what I've got highlighted here is the address and phone and fax number for the New York City PESH office.
Okay, great.
Yeah. And
So
so
if anybody needs that information.
right, Susan, I sent you the update of PESH,
Right,
their email addresses. So if you could send that out,
we will
there's,
do.
right, there's also the email addresses,
Great.
email addies, and that might be a good way to contact them as well. So that
Yeah.
is updated as of October 25th. So I know it's pretty accurate.
Great. You know, I didn't share that because it was rotated and I couldn't manage to unrotate it on the.
Right, I know when I
PDF.
scanned it, that's, I'm sorry, but that's how it came out, but
Right,
yeah.
anyway.
So there
Yeah.
are a lot of sources, and as Ellen said, it's about how to navigate them and find out about them, which is why I think having meetings like this is because it's impossible for one person, you know, to know everything. I met somebody from AFT and he's self-taught as I am myself, and it's no matter, you think you know something really well and somebody's going to bring up one thing that you don't know. So it's ongoing. The learning is continuous all the time. So it's best to reach out and somebody will know somebody that can help you.
Are there
And I
any
can
other
also
questions?
just,
Oh, go
to
ahead.
Tim, this is the Sage building.
This is the theater building.
Yeah. Yeah, we'll be in touch about that.
Okay.
We've been getting, I was alerted about that today, so.
Yeah. And we
From-
never had a health and safety walkthrough for COVID ever in that building. That just never happened.
Yeah, well, it sounds like you're due for a walkthrough for many reasons.
Many,
Many
a lot of
reasons.
reasons. Yeah.
Yeah,
Yes.
yeah. So we'll follow up on that.
Okay, thank you, because the president's really been stalling us for a long time with this.
Right. Mhm. So I just want to say one thing to Teresa. She's a member at BCC. I just want you to know I graduated from Bronx Community College. That's where I got my nursing degree. So
I
it
forgot to
is,
mention that.
I
when
was
interviewed.
so excited when I got this request because I was born in Manhattan and grew up in the Bronx and Fordham Road. And so when I heard that, you know, I would be talking to CUNY, I was very, very excited. So I want to thank you for inviting Ellen and myself. We're just thrilled to be here.
Yes, thank you so much. It really was a pleasure. And you are brothers and sisters of ours, and
Yes.
anything that we can do to help and support you, please, by all means, get in touch with us.
Right. And before I go, I wanted to let you know one other source, and that is NYSUT. So if you look on the NYSUT website, you're going to go to who we are, and you're going to look up health and safety. And underneath that is the 2021 Health and Safety Conference. There's a resource book, and I will see if I can email it to Susan and tomorrow. And in it has, some of it is K through 12, won't pertain to you, but a lot of the NYCOSH and PESH and OSHA is in there. And it's a great resource in
It
terms
is.
of just having information. The more information, the more knowledge, as you know, the better you're going to be able. Because the bottom line, as much as I like to say, the employers have a responsibility. Sometimes we have to remind them that they do have a responsibility to make sure that we work in a safe and healthy manner and in a building that is safe.
Well
I
put.
am going to have to sign off. I'm sorry, but thank you so much.
You're
Really
welcome.
appreciate being
Ellen,
invited.
thank you. Yes, thank you so much.
Yeah,
Patricia,
thank
you both.
This was, it's so great to hear from, you know, you've got similar experiences, but lots to bring to us. So we really
Absolutely,
appreciate it.
and we're not that far away from each
No.
other. So there
We
you
are
go.
not.
Stay
So,
in touch.
you know, definitely share my email address, so you can definitely reach out.
Okay,
Yes.
thank
All
you.
right.
Thank
Take
you,
care, all of
everybody, for
you.
coming.
Thank you,
Thank you.
everyone.
Take care.
Bye-bye.
coming.
Bye-bye. Thank you.
We will be
Take
in
care.
touch with the recording and handouts.
All right. Thank you so much.
Thank
Bye-bye.
you. Bye-bye.
Okay. Bye.